This is A Fatal Dose, the rise of fentanyl in our community, presented by the Cummings Foundation and the Washoe County Sheriff's Office.
Well, we are taking time this evening to address a growing problem in our community, fentanyl. We're getting a closer look at its impact, not just on those battling addiction, but on the family and friends left to pick up the pieces.
The Washoe County Sheriff's Office is taking steps to raise awareness, sharing real-life stories showing how this synthetic opioid is destroying lives and leading to deadly consequences. Sheriff Darren Balaam joining us tonight to share this message with the community.
We recently produced a video that showcases our multi-pronged approach to combating the fentanyl epidemic through education, enforcement, prevention, and rehabilitation. Whether you're a parent, educator, teen, or concerned citizen, we want you to see how this video exposes the truth behind the startling issue and the ongoing efforts to create positive change here in Washoe County.
I'm Dr. Davina Longshore with the Cummings Foundation for Behavioral Health, and we're proud to work alongside the Washoe County Sheriff's Office and COLO 8 to bring you this special segment. In a bit, you'll hear about our programs to support law enforcement in their efforts.
And now, here's Fatal Dose, the rise of fentanyl in our community.
Come back to me, man. Come on.
It's death in disguise.
A danger to our community.
It's devastating.
Ruins lives.
Very addictive.
The most dangerous drug in our community.
It's deadly.
Destroys families.
The worst decision you'll ever make in your life if you choose to do it. I promise you that.
Fentanyl is chemical warfare.
Fentanyl found me on my front step. I've never even done fentanyl, and I lived in a nicer neighborhood in Reno, and one day this guy is just on my front doorstep. I lived in a condo complex, and he offered me fentanyl. Like, he was at my front door. It was that easy. I mean, I didn't ask for it.
Fentanyl is an increasing danger to our community. In the last few years, drug-related offenses in Washoe County have nearly doubled, from 620 to over 1,200 in 2023 and 2024. Many of these cases are linked to fentanyl. It's being sold on our streets, trafficked across regional highways, and contributing to a dramatic rise in overdoses. The number of overdose calls we respond to has skyrocketed, putting lives at risk every day.
A lot of the times individuals don't even realize that they're on fentanyl because fentanyl is being mixed in with other substances that they may be using.
I just don't want anyone else to ever have to go through what I've gone through with losing a child to this.
Washoe County 5 positive canine alert.
Fentanyl is here. It's in our communities. It's in our schools.
Around 2019, we'd only see a handful of fentanyl cases. Now we're up to over 100 a year that we see, that we analyze, which is about 20% of our workload.
Fentanyl has become such a big problem because it's so addictive and because it's so easily accessible.
He was very much about family. This is my most favorite picture ever of him and his daughter. They were very, very, very close. He was such a good dad. In the summer of 2007, a week before he started UNR for art, he suffered a traumatic incident. Jake was stabbed over 25 times. His friends were pretty badly beaten up as well. He called me and asked me to come take him to the emergency room because they broke his nose. He was in shock. He didn't know he was stabbed. By the time I got there, he had taken off his sweatshirt, and that's when they realized that he had been stabbed. And so by the time I got there, he was in the back of the ambulance, and he was really scared. He had one therapist tell him that his PTSD was that of somebody that came back from war. And I could see that. It was like he was like this beat up battleship, you know? He hated his anxiety. I mean, it was so bad. He just changed. And so I took him to our doctor, and the doctor put him on Xanax after much hesitation from Jake. He was like, I don't want to be on that. You know, I have friends that are addicted to it. And the doctor was like, well, you know, you just take it when you need it. I think Jake realized that it was self-medicating.
They go hand in hand. Self-medicating with trauma is
what really adds fuel to the fire for addiction.
And then within 5 months, he was using other drugs to self-medicate.
For the most part, every person that I've sat down with over the past 5 years has some sort of childhood trauma or recent adult trauma that has instigated the self-medication and then the numbing out.
And that's the thing about addiction, is that it numbs you. You don't feel pain, you don't feel your traumas, you don't feel any of that thing, and he told me many times that's why he did it.
A lot of times people look at addiction as a choice, a simple choice for a person not to use drugs. Unfortunately, addiction doesn't work that black and white.
My substance abuse evolved from just getting prescribed, painkillers. And I was, 20 years old at the time. I didn't know, I was in college, I didn't know that, these are gonna ruin your life. It happened so fast before I could grasp what was going on, and I became an addict quickly. And before I could have any control over my addiction, my life had spun out of control.
My son was so mad that he was an addict. He hated it. He would cry to me and say, "Why me? Why me?" It's not like he woke up one morning and chose to be an addict,
It is very pervasive throughout a person's life. It can take over their reasoning, the way that they think, and control how they behave and what they do depending on what they're addicted to.
I was powerless over my addiction.
Unfortunately, relapse is part of the process in addiction treatment.
And then he had to start all over with the methadone clinic, and he had a lot of guilt. And he beat himself up a lot, and he felt very guilty, and he felt horrible about it. And I would tell him, relapse is part of recovery, Jake. It's part of recovery. Don't beat yourself up.
When you recognize what your triggers are, what bothers you, or why you used, you can learn from that mistake. It's different to go from using all day, every day, to maybe having to slip up once, in a year or two. You have to learn from your mistakes and be easy on yourself, because this road is not easy.
The rise of fentanyl within our community has had a direct effect within the walls of our detention facility. As overdoses skyrocketed in our community, we saw that same increase within the detention facility.
The fact that such a small amount of fentanyl can have the desired effect for a person means that a smaller amount needs to be smuggled into the facility.
I heard a medical emergency called over the radio, so I responded to a nearby housing unit.
You never know what you're going to walk into. You only hear maybe 2-3 words that come out of that unit.
We decided that it was a possible overdose.
Got Narcan.
So my partner, Deputy Chiz, administered the first dose of Narcan, and we waited 2 or 3 minutes and we didn't see any changes. So I administered a second dose of Narcan.
And that's when we saw seeing positive signs of him coming back to us and making contact with us. His face has changed color, and we knew that he was starting to get well.
We've been taught to see the signs and symptoms from various different types of drug overdoses, fentanyl being one of the biggest, newest ones coming throughout our community. We are all also equipped with Narcan that we keep on our person in case there's any accidental overdoses or to save someone that is overdosing on fentanyl.
Trying to prevent drugs from coming into the facility is a never-ending battle. We have to think one step ahead to try and prevent those drugs from coming into the facility. We try and anticipate what their moves will be, and using technology, good old-fashioned detective work, and dedication, we do our best to try and prevent it.
In fiscal year 2023, we had 29 fentanyl overdoses within our facility. In fiscal year 2024, we were able to reduce that number to 23 overdoses, in large part due to the issuance of Narcan to all of our staff members and the experience at responding to those emergencies.
So they will probably get you hooked up on a Zoom court meeting with this. Just understand that you have this court date and communicate with that to Vitality when you get there, okay?
The role of the Detention Services Unit is to provide programming or resources or to connect individuals to programming and resources in the community, both for court-ordered and non-court-ordered individuals who happen to be incarcerated at the Washoe County Jail. We need to approach it from all angles, so not just the substance use, but from mental health and from homelessness, because if we do not provide wraparound services that address all those needs, the likelihood of them engaging and completing programming is significantly lower. So we want to make sure that we not only provide resources for substance use, but we want to look at housing resources and we want to look at mental health resources, because very seldom in our population, especially the ones that end up in our facility, do we have one of those without the other. Usually individuals that have substance use also have underlying mental health or are experiencing homelessness at the same time.
At the beginning of my career, when somebody was released, we'd give them a bus ticket and we'd hope they would connect once they walked out our doors with resources. And through our experience, we found that was not the case. What DSU has done is they've ensured and filled that gap where somebody, when they're released from our facility, they transport them now and connect them with those resources in our community. And what we've seen is recidivism has gone down and success has grown exponentially within our community.
You guys excited to get out of here? Hell yeah. All gonna be successful, right? Yeah, there we go.
One way we're helping those dealing with substance abuse issues be successful is through our MAP program.
Good to see you again. How's your week been?
It's been good.
Good.
It's been...
You went to court, right?
Did.
How did that go?
It went well.
Medication-assisted treatment, or MAT, is an evidence-based program for opiate use disorder. It combines medication with behavioral therapy so that it's a holistic approach for addiction.
There are only 11 opioid treatment programs in the state of Nevada, and we are the only jail-based opioid treatment program. In fact, there are very few jail-based opioid treatment programs across the country.
Fentanyl is one of the substances that we have seen increase significantly over the years. So we are trying to provide services and resources specifically to target individuals that are experiencing that addiction.
It's important to have this program because the population that comes in have very little resources to treatment. And once they're in custody, we can get them off of the illicit drug use, which clears up their mind a little bit and gets them stable so that they can work on why they use, not continuing to go in and out in the revolving doorway.
After they cut you off, you get so sick and you have cravings for these drugs that you did not even know. This monster comes out of the closet that you didn't even know existed and takes over your life. MAT medication is crucial for people in recovery or people detoxing from fentanyl. It can be dangerous, and without the right medication and supervision, it can be fatal.
The other part of MAT is not just starting people on a MAT process here in the jail, but also if they've already been started on a MAT program within the community. So they've already been receiving those medications. We don't want to stop that treatment and stop those medications just because they happen to be in our facility and incarcerated.
For the participants that I meet with, it's usually their first time sitting down one-on-one with a counselor who supports them and takes them at face value. The response to that is overwhelmingly positive. They feel supported, they get a breath of positivity, and they find that strength to keep going.
Just holding my son again is going to be worth every second of this nightmare. I'm so excited.
When we first started the program in September of 2019, we had 3 participants in our program. Today we are at 36. It has grown significantly over the past 5 years.
The success of our MAT program is measured by recidivism. Over the past 5 years, we've shown a great reduction in recidivism for those individuals that have been in our MAT program. Of the 716 participants in the first 5 years, only 208, or 29%, recidivated within the first year of leaving our facility.
The MAT program, since I have been in this jail, has definitely saved my life. I was in a mess when I came in, and over the past 4 months, I have turned into something I'm proud of.
Continuity of care is critical to a MAT patient's success as it reduces occurrences of relapse, but most importantly, decreases fatalities. Our team has been focused on working with partners to ensure the MAT program is available to inmates entering or exiting our facility on treatment, whether going to a community program or the prison system. We hope accessibility for the MAT program and services continues to expand throughout our community to ensure those experiencing substance abuse have the services they need, ideally before it's too late or they enter the criminal justice system.
I've had to Narcan like 15 people, And that's really powerful, saying that somebody who just takes a hit of fentanyl, you look over and they're blue. I mean, that's tragic, it's traumatic, it's sad, but they didn't think their drugs were laced, and they had no idea.
The day he died is still very traumatic to me because it was on my birthday. And I mean, I'll never forget that phone call as long as I live. He took a Valium that he got from somewhere. Someone gave it to him, or he bought it from somebody. He had a Valium and 2.7 milligrams of fentanyl in his system. So that pill that he took was the lethal dose.
A significant number of the counterfeit pills that we would see have potentially lethal amounts of fentanyl in them, and people aren't even realizing that.
Fake tablets, clandestine tablets, were fairly easy for a trained eye and analysts like us to recognize. Since the mass production of fentanyl tablets, the quality has improved to the point that we can't tell right from a quick look that a tablet is fake, to the point that we assume all tablets are fake until we can confirm that otherwise.
Everything you buy on the street is dangerous.
Unless you have a prescription from a licensed medical professional from a valid pharmacy, you have no idea what you're about to ingest. Illegally manufactured drugs don't come with an ingredient list. There's no controls on how it's produced, what's being regulated, and so what you're receiving could be 10 times more potent than what you're used to. If you have a tolerance for opioids, that might not even matter based on the amount of fentanyl that's been included in this illicitly manufactured.
Over the past 2 years, the amount of fentanyl seized in Washoe County has spiked by approximately 2,500% compared to 2019. We've seen a rise of fentanyl in the powder form, and it's being mixed into other drugs circulating in our community, increasing the risk for unsuspecting users.
In Washoe County and in northern Nevada, we have transitioned to more than 50% of our fentanyl cases becoming powdered fentanyl. The danger or added danger of powder could be that it could be mixed with other drugs more easily than when it comes in pill form.
Recently, we've been seeing that fentanyl is infiltrating a lot of the drug supply, including methamphetamine, THC, the THC cartridges. We are finding fentanyl in a lot of different areas of the community. It is very prevalent.
Washoe County has taken cases of fentanyl being distributed to our students and in our schools, and students are overdosing. This is a pivotal age for us to reach these high school students and bring awareness to them so they can make informed decisions to keep themselves safe.
We know fentanyl is in our community, and it's often disguised in illegal pills. It's imperative that we raise the awareness with our families and our community on the dangers and often lethal consequences.
It is so important to have these conversations and have them be open and productive rather than having your student hide away and try to keep these things a secret when they might need help. The reality is that your teen may experiment with illicitly manufactured fentanyl. It could be their first time, it could be their 10th time, but this experimentation might cost them their life.
911, what's the address of the emergency? Do you think they're overdosing on fentanyl? Is that correct?
Now we're in a whole new ball game. Now we have fentanyl. So it's not just about, oh, you're going to get addicted to drugs, drugs are bad, blah, blah, blah. Now it's basically you're playing Russian roulette with your life.
The reality of an overdose does not discriminate. It takes a small amount of fentanyl to cause that, and it can happen to anyone.
Being aware of the dangers of fentanyl is something that everyone can be responsible for. Parents can talk to their kids, teachers can talk to their kids can talk to each other. We're all going to experience witnessing an overdose in the future. By being aware, we can help prevent a death.
Being assigned to the school, my door is always open to the students. If you need help or if you need assistance, reach out to a trusted adult or a mentor as a resource.
People are overdosing and dying. This is real, and it's happening in our community, affecting families, friends, and neighbors with the devastating consequences we witness every day. To combat fentanyl distribution, we relentlessly work on the streets and across our region to investigate and apprehend those selling and trafficking this lethal drug.
My message is to someone who thinks they can pick up fentanyl and be okay and just hit it once. Don't do it, because you're going to ruin your life. And I'm going to tell you that I never thought it would happen to me. And everything I said I never became, I became. So, but I think you're better and you're special and, you know, you're untouchable. You're not. You are not untouchable, and it's going to happen to you.
incredibly vital to show a person empathic support without judgment so that they know that they're okay as a human being. They're okay to say, hey, I need help, and to get that help without feeling like there's something wrong with them. That's what fuels successful treatment and ongoing long-term recovery.
Recovery could be years, if not decades, so we need the long-term case management and long-term programming for individuals that are recovering from substance use.
His death has impacted everybody. It's almost like a shockwave, and it just has you know, filtered out like in so many directions. I will never be the same ever. I will miss him every second of every day until I'm with him again.
No family should have to go through what Jocelyn and her family went through. I want to thank Jocelyn for sharing Jake's story and Jill B. for sharing hers. Thank you to the dedicated and passionate Sheriff's Office members, first responders, and community partners who are working the front line of this epidemic in saving lives and keeping our community safe. We need to work together in the fight against fentanyl in our community. If you or a loved one has a substance abuse issue, please don't wait. Reach out and ask for help now. We have resources in our community, and we stand with you in this fight.
You just saw how greatly our community and lives are being impacted by the fentanyl crisis. And it's not just those who ingest fentanyl and their families, but our law enforcement officers and first responders. Dr. Davina Longshore is joining us now. She's the executive director of the Cummings Foundation for Behavioral Health. Thanks for coming in.
You're welcome.
Can you talk about what you're seeing when it comes to our law enforcement, how they can't just respond to these incidents, they can be traumatized?
Right, so there's a growing concern, and it's supported by research, that your officers are experiencing trauma when they respond to incidents like a fentanyl overdose. And these traumas are leading to mental health challenges. They manifest themselves as depression, anxiety, substance use disorders, and trauma stressor-related disorders such as PTSD.
And your program is focused on providing no-cost help to police officers. What exact programs do you offer?
The Cummings Foundation for Behavior Health implements and funds mental health and wellness programs for law enforcement across the United States. And we do that based on an integrated wellness model that I created. It includes things like wellness checks with psychologists, dietitian checks, metabolic screenings, resilience training, and peer support.
How can people get more information and get involved?
If someone wants to bring these services to the law enforcement in their community, they should visit our website at www.cummingscfph.org, and under About Us, click Contact Us. And if they'd like to donate, they can also visit our website and click Support Us at the top of the webpage.
Obviously so important for people to get help if they need it. Thank you so much for helping us with that. All right, thank you so much for joining us.